Human anatomy and physiology is the study of the structure and function of the human body. Just one sentence of human anatomy and physiology. How much we have studied about anatomy and physiology in your life, or in your career, or in your field of application of anatomy and physiology? Maybe some 1 hour subjects for each system of anatomy or physiology chapters. Maybe some 12 hours, 20 hours, 50 hours, or you might have studied little more detail in nursing or paramedical studies or yoga studies. So here we are offering a medical yoga classes mainly for the students and the teachers who have done some or other course of yoga. Mainly the anatomy and physiology is most neglected part, and it is most important part of application of therapeutic yoga. Most of us, we are in hurry. We want to complete all the topics or syllabus in 1 month or 2 months of your study, and after that we consider ourselves as XYZ yoga masters, 200 hours, 300 hours, 500 hours, 1000 hours, perinatal, prenatal, antenatal, master class, all those names and forms and certificates. But knowledge wise, we are still the same bacha or the small boy of anatomy and physiology, where we study very little and apply very minimal. So what differentiates us from other yoga teachers or other people who are into health science or dealing with the therapy aspects is the intricate detailed understanding of the human body. The human body consists of intricate parts with coordinated functions that are mainly maintained by a complex system of checks and balances. The coordinated functions of all the parts of the human body allows us to detect stimuli such as observing a sunset, respond to a stimuli such as removing a hand from a hot object, perform mental functions as remembering, thinking, and so many other functions. The study of human anatomy and physiology is important for those who plan a career in the health science. A sound knowledge of structure and function is necessary for healthcare professionals to perform their duties better. Similarly, yoga teachers, so-called yoga masters, gurus, all those people, religious heads of various religions, I don't want to name, Swamijis, gurus and all those, they must know the understanding of anatomy, physiology, at least to understand the elevation or evolution of Kundalini or other parts of the body, so that they can feel the changes happening in their body and apply this knowledge to teach their students or disciples. Understanding of anatomy and physiology prepares us to evaluate recommended treatments, critically review certain articles, literatures, or for healthcare professionals or for non-healthcare professionals. The knowledge of anatomy and physiology is very vital. So, I have done my MD in yoga and rehabilitation, followed by MBBS, the modern medical science, where we study in depth about anatomy and physiology. So with the background of medical science and coming into yoga field, I want to explore and share much of the contents needed which is lacking in the field of yoga because of diluted horizontal growth rather than the knowledge based vertical growth. So we are here to share the deeper knowledge of anatomy and physiology for yoga students with various levels, maybe level 1, 2, 3, 4, 5. Choose your level of practice. Start with level 1, understand the overview of anatomy and physiology, and then go ahead and study in detail if you need it to apply to practice yoga therapy or medical yoga. So, see you soon. Thank you, one and all.